Orthopedic Surgeon Dr. Thomas Gautsch joining us this evening for our Medical Monday segment. Doctor, thank you for being here tonight.
Oh, thanks again for having me.
We are learning a lot about just the advancements in procedures, and we are already getting to some calls. So thank you all for calling in with your questions. We still encourage you to do so. We're on for the next hour or so we got a lot to talk about. We did before the break, though, have a viewer call in, and she actually had a two-part question. So we're going to go ahead and get to the second part of that answer.
Right. So we were talking about patella fractures and the fact that often down the line after a patella fracture, people will develop arthritis. And that can start off first as just kind of a crackly, grindy under their knee, maybe then start to become pain when they're going up and down stairs or climbing. Eventually, unfortunately, it'll often advance to the point where it really becomes a significant quality of life issue or starts to cause secondary problems like it sounds like you might have been having. So the second part of your question, though, was is that something that can be fixed with a knee replacement, and is that going to complicate things or make it more difficult? And the answer to that in a simple way is probably not. If you recovered sufficiently from your original fracture to get back on with your life, then probably things in the bony parts healed up well. So the structure of the knee has been regained and healed, and that's all that you really need to do a replacement. Now the good news for you is that sometimes when people have just had trauma, like a fracture, and develop arthritis, it's only one part of the knee that is affected, and you might be a good candidate for a partial replacement rather than the total replacement. Just a little simpler surgery, it's a little faster recovery. Not hugely faster, it would still be probably 4 to 6 weeks to get over it, is typically my patient's experience when I do it, whereas a knee replacement is closer to 6-week recovery when we do the outpatient. But as long as the structure, the patella and the muscles and ligaments are still good, when it comes time, and it's a quality of life issue really, when it comes time, you'd almost certainly be able to have that.
All right, wonderful. I believe we have another caller here on line 2, I think, with us, perhaps. Can you hear me? We'll go ahead and check line 1, perhaps. All right, maybe we went ahead and lost them on break, but we do encourage you to go ahead and call us. Again, that's great advice. I mean, that's just so wonderful thing about this show is it's Medical Monday, and our topic each week, is different with a different topic, but we really do encourage you to call in that number. I'm going to give it to you here. I had to find it on my paper. There it is. It's 615-737+. So if you have any other questions, as you can see, Dr. Gautsch is happy to answer them for you. And if you even have a story that you want to share with us relating to tonight's topic, which is talking about better understanding outpatient knee replacement. Now, we said we're talking about not just knees, but shoulders as well tonight. But let's go ahead and talk about the short stay knee replacement. What are the candidates? Who qualifies? What are you looking for? Just to let folks know.
Okay, so a fast track, we would call it, or an outpatient knee replacement is for an individual who has stayed active despite the fact that they're getting arthritis typically, and is very motivated to get through a procedure and recover quickly, and is in generally good health. With those criteria, that person can withstand the surgery and what they have to do in the first couple of days afterwards, which can be a little bit challenging, so, but people are doing it all the time and working through it well. It's a nicer, faster way to recover from the traditional way of doing knee replacement. It's a combination of things that allows us to do it. It's really the culmination of applying what are really some sports medicine type principles to joint replacement. So I'm very careful not to injure tissue as much as possible at all during the course of surgery, and don't cut through it in the muscles. We don't cut through the ligaments. We leave everything that is good intact, kind of sneak in, do the surgery, put on new surfaces, and then people can start moving it and using it right away. So that allows us to get people home the same day and then start rehabbing right away.
That is the goal, fast recovery for sure. Now we actually do have Darlene on line 2 here. Hi, Darlene.
Hey, honey. Y'all cut me off at one time, so.
We got you back on now, Darlene. What's your question for Dr. Gautsch tonight? What can we help you with?
I was wondering why, with my first knee surgery, it was hardly no problem. With my second one, I had all kinds of problems.
Great, we'll put you on hold for that answer.
So hard to say for sure, except that sometimes having surgery is a little bit like having kids. One can be super easy and the other one can be difficult.
That's a good way of looking at it.
And there can just be a variety of other things. I'm sorry to hear that you had a hard time with your second surgery. It's more typical that people are able to get through it fairly, consistently, reliably, but everything is a little bit different. It's
kind
it's
of
not an exact science,
case by
unfortunately.
case,
Right.
unfortunately.
But knee replacement as an operation is one of the most successful things that we do surgically, actually. When we've looked at it across the country, all the surgeries that are done, knee replacement is actually one of the highest yield, most consistently, predictably good things that people can do to improve the quality of their life.
Now, earlier you were kind of mentioning the criteria that you look for in a candidate for these types of procedures, and you mentioned we look for a candidate who is healthy. Define what a healthy candidate is.
Well, so having a surgery like this, really any surgery, puts some stress on your system. So if people have got pretty significant heart disease, that increases their risks because of the stress of surgery. Similarly, if they've got lung problems, pulmonary problems, that can pose a risk to them. Most people who are candidates for knee replacement and who are being active enough to be bothered by it are usually healthy enough to go through the procedure. But we always check with a primary care physician, or if somebody has a cardiologist, we check with a cardiologist first to make sure that the risks are minimized.
Now, I'm curious, this is a personal question here while I got you here tonight.
Sure.
Your typical patient, who is it? Or does it just vary? I'm thinking, I thought I saw something where typically women receive the rotator cuff surgery more, and if so, why? Or do you see a lot of athletes, young people who maybe were more into sports as youth and later on in life? Who is your typical patient, or is there a format?
Well, the nature of my practice is that it does have a sports emphasis. So I see athletes at a number of different times kind of in their career. I see athletes when they're young and have initial injuries. I see them sometimes when they maybe have a secondary problem that develops 5 or 10 years down the line, or maybe another injury when they're a little bit older. And then, unfortunately, and I put myself in this field too, in this group as well, that the consequences of injuries when you're young sometimes come back to haunt you when you're in your 40s, 50s, 60s. And so a lot of the people that I see for knee replacements when they're in their 40s to early 60s are people who have been athletic in their life and have continued to try to be somewhat athletic as adults, and they've just worn out their joints.
They sure have.
Yeah.
Let's go ahead and take another call. We've actually got Michael on line 1 now. Hi, Michael. Thanks for calling in.
Hello.
What's your question tonight for us?
I have 2 issues. One issue is I have lymphedema, and another issue is I have arthritis. And I was just wondering if you would suggest surgery or just, I guess, bad pain.
Thanks for calling.
Sure. So yeah, that lymphangitis that is a tough thing, and I'm sorry that you're having to suffer with that because we don't really have a cure for it yet. At least the vascular guys that are working on it haven't come up with the thing yet. If the lymphedema is severe, then it can increase your risks with the surgery. That's not to say that you can't have it, and sometimes it's one of these trade-off things where you get to a point where the joint is so badly worn out that you just can't go anymore. And if you're not being active, as you know, your lymphedema gets worse. So the ideal thing is to try and intervene before the lymphedema gets so bad that you can't have it, if you're going to. Now, where you are on that spectrum now, obviously I couldn't say. I'd be happy to see you if you wanted to, or you could talk to your doctor about whether he thinks it would be a good idea for you to have something like that. But that's all just to say that that having other diagnoses doesn't necessarily mean that you can't have replacement. We just need to take it into account so that we don't put you at undue risk.
Wonderful. Thank you for that question, Michael. We appreciate it. And we now have Randall on line 3. Hi, Randall.
Hey, how you doing?
Great.
Good,
Thank you
thank
for
you.
calling in tonight. What's your question you have for Dr. Gautsch?
Well, I just started watching this tonight, and my question is, I never heard anybody mention total knee replacement if you have arthritis, and I'm 61, be 62, and I have, I guess, some knee knee problems going on. I really don't know what it's related to other than I'm on my feet all day long. And I never heard anybody say anything about knee replacement connected with arthritis, so I was going to ask him about that.
Sure.
Yeah, thank you for calling in.
Yes, great question. So, although we're talking about knee replacement, the fact is that knee replacement is all the way down the line in terms of treatments for knee arthritis. You hope to not have anybody ever say knee replacement because of your arthritis. Hopefully it won't get to that point, or hasn't gotten to that point yet. There are a number of things that we do first as knees are starting to get arthritic. So there are medications that we can use, arthritis type medications. There's injections that we can do. A variety of different medicines now are available for injecting to try and push off the need for knee replacement. But unfortunately, the nature of that problem is that it tends to progress with time. time in use, just like the tread on your tires wears out over time. If it's already mostly worn, it won't be very long before it's completely worn. Just depends kind of on how you use it. It's a matter of time. So as we're living longer and being more active, a lot of people are finding that they ultimately have a lot of pain from their knees that are keeping them from being able to do the things that they want to. And that's when we start talking about knee replacement, when everything else isn't working anymore and it starts to become more trouble than you want to put up with. So the good news is that there are literally almost 1 million knee replacements being done in this country each year now. Within the next 10 years or so, that'll go up to about 3 million, 3.5. I mean, there's a lot of people who've been very active who are outliving their knees. But we've gotten very good at it now, to the point where we can take a surgery that used to require a 3 or 4 day hospital stay, and by various techniques and devices and medications and things, successfully perform that surgery now in the right setting at the surgery center that is built for it, that we've built up in Hendersonville, about 20-minute ride from Nashville, where you can have that surgery and go home the same day, walking on it with your full weight, moving it, and typically recover in about 6 weeks or less.
So many great questions. We appreciate you calling, and I hope this is able to help you tonight. And we're going to keep it right here talking about this topic this evening. And coming up after this next quick break that we're going to take, we're actually going to bring out one of your very own patients who herself has been through this, not 1 but 2 surgeries. So keep it right here. We'll be right back on The Plus.